This is Hannah's insulin injection video. First, I'll just start by showing you that I received an order for 12 units of R and 16 units of NPH, and that is to be given to my patient before breakfast. So now I will show you my vials. So that was check 1, is seeing it. Now I'm checking the order and while I'm obtaining the insulin. So that's my second check. And then I'm going to remove these caps and I will just discard those. So now I will do hand hygiene. And I will just put my clean gloves on. And I'm going to clean the top of my syringes with an alcohol swab. So I will clean each one for 10 seconds. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And now I'm going to mix my NPH because this is the cloudy stuff and stuff settles at the bottom. So I'll do this just by rolling it in between my hands. And I'm going to make sure to do this gently so I don't get any air bubbles. All right, so that's mixed. And now I'm going to take my new needle, I'm going to open it, and so now I'm going to inject air into each of these. So I'm going to inject the air into the end first, so that's 16 units, so I'm just going to pull back the plunger to 16. It's kind of difficult to see, so I'll just remove the top, and now I'm going to carefully stick this in here and push the air in and remove, and then I have 12 of R, so I'm going to pull my plunger back to 12. And I'm going to inject the air into here. And now I'm going to draw back 12 units. And I want to be careful not to get any air in there. And now I'm going to take my NPH, and I need 16 units of this, which makes a total of 28 units. So I'm going to pull back until I'm at 28. Okay. I'll show you 28 units. And now I'm just going to cap my needle. So okay, so I scooped it on there, and now I'll just secure it. Okay, so then I would put the name of my patient, what this is, and how much it is, because I didn't fill the syringe in the room, so it has to be labeled, so I know what it is when I'm bringing it into the patient's room. So now I will take my gloves off, and I'm going to go into my patient's room. And before I go into my patient's room, I'm going to ask them, or I'm going to check the order again. And I see 12R, 16N, and I know that I did that. I just did that, but I would check it with another nurse. And so then, here's my patient. So I would knock, 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 wash my hands as I'm coming into the room. Hi, I'm Hannah. I'm going to give you your morning insulin before your breakfast tray gets here. So wash my hands, and now I'll don some clean gloves. Can you tell me your name and your date of birth? Okay, perfect. And I'm just going to check the order one more time on the computer when I'm in the room to make sure that the order is correct and that I have the correct amount of insulin. All right, so here's my insulin. Now I have to pick the site, and I picked their abdomen. So I'm going to clean it from the inside to the outside for 10 seconds. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, now I will let that dry, and I'm going to pinch. I'll remove my cap from my needle first. I'm going to pinch, and now I'm going to dart at a 45-degree angle, and I'm going to secure, and now administer, pinch again, remove at the same angle I went in, and now I'm going to cap it on a surface that's not my hand so I don't poke myself, and I'm going to dispose of this in a sharps container. Remove my gloves and perform hand hygiene again. So now I will monitor for signs of hypoglycemia after giving this insulin. I'd make sure that they get their breakfast soon after I gave that insulin. And I'd want to watch for a low blood sugar from the MPH about 8 hours from the time that it was given, and then 2 hours for the regular. And then, okay, so then I will do my post-steps now. So I'd ask the patient if they needed anything. I'll make sure they had their call light, and then I do hand hygiene as I walk out the door. And that is my insulin injection video.